Good afternoon and welcome to our Learn and Share conference call. I am Russ Derry, the Director of Education for Epilepsy Foundation of Michigan, and I'll be moderating this discussion. The topic for today is public policy advocacy to benefit the epilepsy community. And we're pleased to have as our speakers Laura Weidner, who's the Vice President of Government Relations and Advocacy at the Epilepsy Foundation, and Rachel Patterson, who's Senior Director of Government Relations and Advocacy for the Epilepsy Foundation. Can each of you briefly introduce yourselves and talk a little bit about your role at the foundation? Laura, did you want to go first?
Sure. Nice to meet everyone virtually. As Russ said, I'm Laura Weidner. My role at the Epilepsy Foundation is leading our advocacy efforts overall, so both at the federal and the state level. And as Rachel and I will dig into, the foundation's advocacy work is really delivered through three channels: public policy, legal advocacy, and grassroots engagement. So we are based, in the Washington, D.C. area, and then we partner with our local offices, like EF Michigan, on both levels, both federal and state. I've been with the organization coming up on 3 years, and before that was with the National Multiple Sclerosis Society for about 9 years, so have been in the neurological patient community for quite a while, working in coalitions based in D.C. and whatnot. We're really excited to talk about advocacy today. We know that some of you have been involved in advocacy already. Like I heard Sonia hop on the line. She plays a key role on one of our advocacy committees. So yeah, just really excited to talk to you today about what we're both super passionate about and hope to inspire you to get involved. And I'll turn it to Rachel.
Excellent.
Thanks. Yeah, this is Rachel Patterson. I work on the public policy arm of what Laura just mentioned in terms of, public policy, legal advocacy, and grassroots, which means I work with Congress and the administration, state legislatures, and occasionally state governments on public policy change to improve the lives of people with epilepsy. I focus mostly on access to health care, but of course do some also disability rights, especially where those two things intersect. So, like I said, we do this at both the state and federal level. At the state level, partnering with our local offices. Michigan is a pretty strong local office, so it's pretty exciting to get to work with them. And you guys have a year-round state legislature, so unlike other states, there's activity all year round in Michigan. Yeah, like I said, it's we work all together on these issues, of course, because almost every issue is probably going to have a legal angle, probably have a grassroots angle, but I handle the public policy change, so legislation and regulations coming out of the administration. And I'm excited to be here with all of you.
Great, and we're excited to have you. So, Laura, can you start by describing what public policy advocacy involves and why the Epilepsy Foundation has prioritized this, and then some of the key strategies used by the national office and its chapters and affiliates to promote public policies that support people with epilepsy?
Sure. So we do realize, that if you haven't been involved in advocacy or policy work yet, it can seem daunting. But I just, we want to be clear from the get-go, by getting involved in advocacy, it's not like we're going to ask anyone to read, a 500-page bill. That's what we're here for as staff of the foundation. It's really about sharing stories and experiences with the right people in order to make changes that help people with epilepsy and the broader epilepsy community. To Russ's point about how advocacy relates to the Epilepsy Foundation, EF is really at its core a disability rights organization. Since our founding, we started existing because people with epilepsy needed a place to go to in terms of getting information and education and helping them with the various challenges and opportunities that present in their life due to their epilepsy. Tony Coelho, a former member of Congress and lead sponsor of the Americans with Disabilities Act. If you don't know of Tony, Tony lives with epilepsy himself, and again, helped usher the Americans with Disabilities Act through Congress, which obviously made significant needed changes for all people with disabilities in our country in terms of, rights and employment settings and having curb cuts so people could get out of their homes and around in their communities. Tony still sits on our national board. We've had great disability rights leaders like Sandy Finucane at the helm of the advocacy team in the past. And again, Tony and Sandy were both instrumental in the original passage of the ADA, and then there was a subsequent law called the ADA Amendments Act, which clarified that episodic conditions like epilepsy qualified under the definition of disability, and therefore, confirmed that people with epilepsy, other similar situations like MS, were in fact entitled to rights of the Americans with Disabilities Act. So again, it's really woven through the organization's history. It continues to be a priority for the organization, and why that is, inequities and challenges persist, and we know that to make things better, EF has to continue to educate elected officials about epilepsy and the community's needs. As I said in my intro, how we kind of organize what we do in advocacy is through public policy. So that includes legislation, regulation, governmental policy that has kind of high-level, broad-scale impacts on our community, legal advocacy, which I'll dig into a little bit later, but essentially educating people about their rights and connecting them with resources to help with whatever they're facing, and grassroots engagement, which is really about activating our community at the right times in order to make the first two things happen. And as I said, we here at EF as staff provide the policy and legal expertise and avenues for action, but we really need people with epilepsy and others in the community to be willing to share their stories to make the issues real for elected officials. And in terms of the strategies that we deploy, as well as our local offices, as I just said, relying on our community to be willing to share their stories and experiences in whatever manner is comfortable and meaningful for them. We, as an organization, behind the scenes, have systems to track legislation and policy in our key priority areas, and we also rely on coalitions to track and engage together because, if we as EF go up to Capitol Hill, for instance, and talk about epilepsy specifically, but if we can band together with other patient disability organizations who have similar interests and needs and all be asking for the same thing, that's a really, really critical strategy to, getting momentum and having elected officials listen to the broader community. And then, of course, just kind of logistically, we have a lot of meetings with elected officials and government agencies, whether it's our community members having those meetings themselves, with our support, or us, Rachel and another team member go up to the Hill or currently have virtual meetings with congressional offices, but representing the needs of our community that way. We send action alerts to our community, which hopefully you're on the list, but if you're not, we can tell you how to get on. And that allows you, like if a legislative committee or a full chamber is about to vote on an important bill, the foundation will send you an action alert, and like with a few quick clicks of a button, you can shoot an email off to your elected officials and let them know what's important to you as that vote's about to come up. We deploy social media. We submit letters on bills and proposed policies, letting the government know whether we support it or oppose it or somewhere in the middle. We kind of like it, but we would recommend these changes. And then also submit testimony, whether it be to a legislative hearing or in-person testimony. So we have a lot of strategies to deploy. And again, we as staff, help determine what makes sense when. But it's really that partnership between us as staff and the community that together really make the difference.
Great. So, Rachel, we'll talk more about some specific public policy issues that the foundation is currently addressing. But can you start by describing the main categories into which most of these issues fall?
Yeah, absolutely. So the way we think about it, there are 4 major buckets. Access to care, 1, research and innovation, 2, education and awareness, 3, and disability rights is 4. So that was just a preview. Access to care means both access to health coverage, the ability to enroll in coverage and afford it, but also that coverage provide and cover the care that you need. So not only do you have health insurance or some form of health coverage, but that it then actually covers what you need it to cover. So that includes, a lot of work on access to medications, utilization management. So some people, have experienced step therapy or prior authorization. That falls under that category of what insurance calls utilization management. But also cost sharing. What are you expected to pay out of pocket at the pharmacy counter for those medications? And is that a barrier to take those medications? This is where we talk about Medicare's 6 protected classes, which is a policy that requires Medicare prescription drug plans to cover all or substantially all epilepsy medications for people enrolled in Medicare who need them. This is also where we what falls into our work on medical cannabis, since that is a treatment that people need to be able to access, even though it's usually outside of their insurance, slightly different than other treatments, but it's a treatment people need to access. We also do work on health disparities under this bucket, both the health disparities faced by people with disabilities and the disparities faced by racial and ethnic minorities and other groups. So that was just one, access to care. It's a pretty big one. That's probably where most of our work occurs. Under research and innovation, that's where we get into things like research funding, so funding for the NIH, as well as legislation that discusses, how the NIH functions or how the FDA functions. There's going to be a big bill coming up in probably being worked on this year and next year that has to do with how the FDA reviews drugs. So then we'll engage on that. Number 3, awareness and education. That's when we get into our efforts around funding for the Centers for Disease Control and Prevention Epilepsy Program. That program does surveillance to see, how many people with epilepsy live in the United States. They do research on, what types of insurance do people have, what types of access to care, what barriers are they facing. And they also do public health education about epilepsy and for people with epilepsy about their condition. Under this bucket also is our Seizure Safe Schools legislation to ensure that students with epilepsy can go to school safely and have someone who is trained to in seizure first aid and trained to administer their medication if they need it. And then finally, the 4th one is that disability rights bucket. So Laura talked about the Americans with Disabilities Act, also the Individuals with Disabilities Education Act, or IDEA. So this is where we discuss, if someone is facing problems with employment discrimination or education discrimination, ensuring that people with epilepsy have equal rights to employment and to access education and other aspects of American life. This also is where we discuss the state level driving legislation. So driving is and driver's licenses are regulated at the state level, not the federal level. This is all at the state level. But that's where that falls, is under disability rights, to ensure that we, of course, strike a balance between public safety, but also the rights of people with epilepsy to drive if they are not experiencing seizures or have had a period of seizure freedom that means it's safe for them to drive. Those are the buckets.
Great. That's pretty comprehensive. So, and I'm sure almost any issue can be finagled into one of those buckets if necessary. So,
pretty much.
So, yeah. Great. So it's been a rough year or two that we've been through, and it can really be easy to become demoralized about the potential impact of ordinary citizens on public policy decisions, especially when you consider kind of the outsized influence that corporations and partisan politics and the drive to get reelected all have on governance. So, Laura, I'm going to ask you to give us kind of a pep talk to reassure us that our voices can indeed make a difference. Can you perhaps share some success stories that demonstrate the power of both individual and collective action?
Yeah, sure. And yes, Rachel and I think I can speak for the whole advocacy team, we totally understand how overwhelming and not worth it this can all seem at times. You watch the news, you read the paper, it never seems like politicians get anything done anymore. Yes, we certainly also have days like that where we're just like, oh my goodness, throwing our hands up. But to the pep talk point, if we don't speak up, if we're not out there representing the needs of people with epilepsy in our community, who will? And it's really critical for elected officials to have those stories and experiences of the epilepsy community in mind as they legislate. And to Russ's point, we actually have despite how hard of a year it has been for our whole country and the world even, we have so many recent examples of successes that, are really proof that both our individual advocates, and our collective power are literally changing lives, even again in the hardest of times. So I'll give two examples. One, this is kind of like it started as an individual and now it's this whole huge, amazing thing. So it's just a really neat story. So we had a teen, the Epilepsy Foundation has an event called Teen Speak Up when we bring teenagers living with epilepsy. We typically bring them to Washington, D.C. It was virtual this year, of course, but, train them how to be advocates, take them up to Capitol Hill to meet with their elected officials. And it's just an amazing event because not only do they learn to be advocates, but, living with epilepsy, particularly as a teen, can be very isolating. So it's also just an amazing connection opportunity for these teens to, learn earlier in their life that they're not alone, that there are other people who go through what they go through. And it's just really awesome because you see these teens come in and within 36 hours, they're all best friends, trading cell phone numbers and, connecting even after they go home. But anywho, so one of our teens a few years ago, Lindsay from the state of Kentucky, she came to this event. She was really inspired. She really got into advocacy, and then she went home. And we have our teens, once they go home, they're supposed to, fulfill a year of service, maybe hold an awareness event at your high school, meet with your elected officials again, keep that advocacy up. But Lindsay, went home and blew it out of the ballpark. She wanted to do something around schools. She, felt like schools weren't a totally safe, supportive environment for students with epilepsy. So she started working with her state level officials about just an idea, what could we do to help students with epilepsy feel more comfortable and safe and thrive at their schools. And within one session, Lindsay got what was called the Lindsay Crunk Act in Kentucky passed, which requires a few things. It requires training of school personnel about seizure recognition and seizure first aid. It requires all students with epilepsy to have a seizure action plan on file so that the school knows how to respond to each individual. It requires administration of FDA-approved therapies, including rescue therapies in the school setting. So again, within one session, this teenager got this amazing bill passed. And then we have, the Epilepsy Foundation has turned that into a model bill, which we're now pushing nationwide across the country. So within the past, since Lindsay got that passed in Kentucky about 2.5 years ago, we've had 10 additional, so 11 total states pass that bill. And that includes 2020, COVID, when bills weren't really moving forward. We've actually gotten 6 of the new states passed just in 2021. So again, you look at this one individual who literally started a tidal wave that is having a real impact on students with epilepsy across the country. It's just amazing. And then second, this is kind of more on the collective power side. Rachel mentioned that there's what's called the Medicare 6 Protected Classes policy, which helps make sure that all or substantially all anti-seizure medications are covered for Medicare beneficiaries. We kind of look at it as the gold standard that, all plans should do, since there's no one-size-fits-all treatment for people with epilepsy. Well, this policy is as great as it is and needed. It does come under threat politically. Every few years it seems a proposal is put forward to maybe restrict access in various ways. A lot of it, unfortunately, is just a misunderstanding of why all the medications are needed. And, honestly, just a cost saver. It is expensive for plans to cover all those meds. So we have to come in and, explain why it's needed, blah, blah, blah. But anyways, there have been certain threats over the years, and EF has really been at the forefront on behalf of the epilepsy community and the anti-seizure medication class. So for instance, we had one of these threats back in January. Our community sent about 1,700 emails sharing why this was a bad proposal, why it would hurt people with epilepsy. We deployed other mechanisms, Hill meetings, et cetera. And again, both in 2018 when we faced the threat and this year in 2021 when we faced the threat, the engagement of our collective community, both times the proposals were pulled back, meaning that the policy stood as is, and plans are still required to cover all or substantially all anti-seizure meds. So, again, and we could go on and on, honestly. It's, again, as difficult as a year as it has been. We've had numerous victories that we're very proud of, and that's really why we keep going.
Great. Those are 2 great examples. So, and can you review kind of the spectrum of civic engagement and some of the more effective strategies individuals can take to influence public policy?
Yeah, for sure. So yeah, we understand, everyone's lives are different and busy. So we, as the Epilepsy Foundation and our local offices, really try to provide many levels at which you can engage as an advocate that will work for you. So, Russ mentioned civic engagement. Obviously, as a 501c3, we do not endorse or get involved with political candidates or campaigns. But even as a 501c3, we encourage voter registration and getting out the vote. So, again, don't get behind any political candidates, but definitely urge everyone to vote and make your voice heard at the polls. And then in terms of as an individual, additional, things you can do, I'll start by saying it's really important to be connected to your local office like you all are. And then your local office, coordinates with us on a very consistent basis from the national perspective. And that's in order to make sure that, EF as a whole across the country, that we're taking consistent positions in different states. And it helps make sure that individuals, if you're advocating with EF, that you understand what our positions are and that you're relaying those positions and that we're able to support you in whatever you need as an advocate. So I kind of say, like, if you haven't been involved yet and you are interested, kind of the entry level, like, I want to see what all this is like. We have what we call our Speak Up, Speak Out Advocacy Network. It's about 50,000 people across the country who have expressed interest in being an advocate. So by signing up, you get our monthly newsletter, the Capital Circuit, which just gives updates on what's happening politically and with policy, both at the national and the state level. And you also would receive those action alerts, which again, we kind of pre-populate and we send to you when a vote's about to happen. And very quickly you can, add your experience and send an email off to your elected officials, whether it be at the federal or the state level. So again, that's kind of a nice way just to get your toes wet, start understanding what's happening, and start connecting with your elected officials by sending emails. If you want to get involved at a deeper level, again, with your local office in our partnership, we can help tease out, sharing your story, either through written or in-person testimony, if that would be something you're interested in. We can help support if you'd like to write a letter to the editor or an op-ed on one of the issues that we're working on. And or if you want to meet with your elected officials, again, about EF priorities, we can help, logistically make that happen. Like if you don't even know where to start, like who do I call or who do I email to make that meeting, we can help you with that. And then at an even deeper level, we have, I mentioned our Teen Speak Up program. I don't know if we have any teens or families with teens on the call today, but that's a great way for again, teens to start getting involved in advocacy. That works through a nominations process through your local office if there are any teens who would want to participate in that program. And then in the past year, we've started 2 new advocacy volunteer roles. One we call our Epilepsy Advocacy Champions. And same, for that role, you would apply and express, why you're interested in it. But that's a deeper level of engagement because if you're a champion, we provide both a monthly training and a monthly advocacy action for you to do. So, rather than just kind of sending emails when you have the time, you're kind of a committed, on a monthly basis, I'm going to do something that's relevant and timely policy-wise. And we help you start and continue to grow that relationship with your elected officials because, again, that consistent, monthly interaction, really helps grow the relationship and keep it strong. And then finally, the second advocacy volunteer role we started is called our Epilepsy Policy Advisory Committee, or EPAC. And EPAC, while champions are about active engagement on policy and talking to your elected officials, EPAC is more about advising us on a high level about what our priorities will be in the first place. So every year we go through a process to determine what we're going to focus on the next year, both at the federal and the state level. And our EPAC, this committee, helps advise us as we do that and, let us know if we're forgetting anything really important, if we have something on our list, but, we should think about it differently. So it's really helpful. And we have people with epilepsy, healthcare providers, researchers, family members, and some EF staff on that committee. And again, I think Sonia joined, and she might still be on. She's on EPAC, so she's been, again, as EPAC's gotten off the ground, really helpful in being one of our advisors.
Excellent. So that's a lot of different ways to be involved, and kind of something for everyone. So that's great. Now, before we dive into current public policy issues relevant to people with epilepsy, Rachel, can you highlight some recent policy victories that the Epilepsy Foundation has helped make possible?
Yeah, absolutely. Laura talked about a couple of those victories, but there are more. And, we have been in an environment where sometimes our biggest victories are things not happening. So preventing something bad from happening. An example of one of those is work requirements in Medicaid. So Medicaid is a joint state and federal health care program. You're probably familiar with it being administered by your state. And there was an effort over the last couple of years to implement a work requirement. Now, that might seem kind of, logical. Maybe you should work if you need health care. But we found that people who are in Medicaid usually either are working, or if they aren't, it's because they have a disability that prevents them from working. And epilepsy is one of those that frequently might not get caught. If there was an exemption for people with disabilities, that epilepsy might not be included in that. So we were very concerned about states doing this because it would cause people to lose their health insurance coverage through Medicaid. And we want to make sure people have coverage, have access to their medications, can get their seizures under control. We worked with a lot of different partners at the state and federal level to try and prevent this. And I could see, it's kind of getting at, why do you engage on an issue? Why would you even get involved if you say, well, the governor doesn't agree with me, they're just going to do it? And one of the things that happened in the Medicaid work requirements is a lot of people at the state level objected to it, and a lot of the governors did it anyway. But then the governors were sued, basically, for implementing it. And a lot of those court cases pointed back to the comments that the public had made while the policy was under consideration and said, hey, state government, you did not consider what these people had to say about their concerns about the issue. And that was us at EF, but it was also just a lot of regular folks attending forums, submitting written comments, and that kind of thing. And across the country, I believe, including in Michigan, we prevented work requirements from being implemented. They were actually only implemented in one state for a couple of months, despite the fact that it looked like they were going to be implemented many, many places. So that's the kind of victory that can fly a little bit under the radar, but we really think that helped a lot of people hold on to their health insurance coverage. And it was a result of regular people speaking up. And even if that didn't mean they were listened to initially, because that was part of the public record, that then shaped how policy works going forward. Some other examples of victories we've had early on in the pandemic, when Congress was working on the CARES Act, we raised that we were very concerned that people would be going to the pharmacy frequently, needing, unnecessarily exposing themselves to the virus. We also knew that CDC was recommending that people stock up on their medication, and a lot of people with epilepsy said, I'm not allowed to do that, either because of controlled substance rules or because insurance, won't cover me to get an extra refill. So we worked with Congress on getting a requirement for longer and earlier refills in Medicare. We also encouraged governors to do the same thing for the private insurance in their state, in Medicaid, and relaxed rules on controlled substances. And I should say the victories on those with the governors is a little more mixed, but we were successful at getting Congress to take action for the federal program. Some other things we worked on, funding for home and community-based services was something we were really, really pushing in several of the COVID packages. That was finally included in the package that passed in December. On the state side, Laura mentioned the 11 states now have seizure-safe schools laws. So that's something that major victory. We had 6 just this past year. That's pretty good momentum at the state level. And, we know there are still a couple of states because legislatures are in session and where the bill is moving. And we expect a lot more in 2022. We were also involved in trying to make it easier to get health coverage through the Affordable Care Act. The bill passed by Congress earlier this year provided additional money, additional subsidies to purchase that insurance. So we were really pushing for that. I mean, we're going to push to continue to make it easier to enroll in health insurance. And then we talked about some of that funding that we push for. We've in the last year seen $1 million increase for the CDC Epilepsy Program, almost a $4 million increase for the VA Epilepsy Centers for Excellence, and increases for NIH and FDA. So, you know, even when things are hard or when a lot of victories are keeping things from getting worse, we've also worked on a lot of things where we have been really successful in moving the ball forward.
That's great. Very impressive. So thank you guys for all that important work. So now we're going to talk about some key public policy issues that the Epilepsy Foundation is currently addressing and how people in the epilepsy community can engage both in Michigan and nationally. So you mentioned the Seizure Safe Schools legislation, and that is currently being introduced in Michigan. So can you give a quick update on that?
I am realizing that I do not have an update off the top of my head about where it stands in Michigan. I should have. Or do you?
Yeah, I probably should have brushed up on that, but I believe it has been introduced. And we have a bill sponsor. So as for next steps, that's what I'm not entirely sure about what the next steps are, but I know that we will be reach and have been reaching out to parents for testimony and sharing stories to support that. So it is underway, and we will be, again, alerting people to opportunities to get involved in that process. So great. Just in terms of like other states that are currently in the process of like how many other states are currently exploring that type of legislation?
I believe that there's a bill in New York. New York is another state that has a year-round legislature. And I'd have to, let me look at.
I can step in.
Great.
Yeah, I can step in a little bit. And sorry, Abby on our team leads this bill, so she is the best for all the specifics. But essentially, Seizure Safe Schools this year, most state legislatures have wound down for the year. We have 2 or 3 bills still somewhat active since their state legislature might be, continuing a little bit for the year. But essentially at this point, it's a lot of, one, just a deep breath. We had a really victorious year. And then a little bit of a hiatus before, come early fall when we'll really start vamping up to plan for state legislatures to again restart come January 1 or shortly thereafter. It's remaining this year, New York, Ohio, Minnesota, and Rhode Island are the few states that continue to be a little active. And then in terms of, Russ, you'd also asked like how many additional states are interested in the legislation. I mean, off the top of my head, I'd say there are probably like 5 to 8 additional ones that are like in the earliest stages, like starting to meet with elected officials, try to identify a bill sponsor. We have a lot still coming down the pike. And then even in there, which I haven't mentioned yet, there are probably about 5 to 8 states who had bills introduced this year. They just didn't get passed. So again, come fall, we'll, start thinking about reintroduction of those bills if that particular state legislature requires that or if it's just rolled over. So, kind of a little pause right now, but a lot more to come and a lot of interest around the country in that bill.
Great. And that kind of brings up the point that sometimes the way to get federal legislation eventually is to have enough states pass state legislation. So like once you get it, you reach kind of a threshold or tipping point where now the federal government starts to consider, well, maybe we should do this too. So I'm not sure if that's in the works or that would be in the plans, but it's just as a general rule, sometimes getting enough states on board with a type of legislation can lead to federal legislation.
That's definitely true, although in the case of Seizure Safe Schools, that is regulated at the state level. So
got it, yeah.
You do have to do it in every state. And that's just depends. A lot of issues depend on whether they're done at the federal level or the state level. Or like health insurance, both.
Yep. Let's talk a little bit about efforts to improve healthcare access. For example, the Safe Step Act. Talk a little bit about some of your current public policy advocacy in that area.
Yes. So the Safe Step Act would reform step therapy protocols. It's a bill at the federal level, and it applies to federally regulated plans. This is a situation where some health plans are regulated at the state level, some at the federal level. And I've been working for many years on step therapy reform at the state level. But those laws don't touch federally regulated plans. So we also have to do the same thing at the federal level. And this is an example of where it's much easier to go into a member's office and say, your state has already done this. Now we're trying to do it, at the federal level as well. So that wouldn't ban step therapy, but it would create guardrails around when step therapy could be implemented, as well as what those processes are like, what kind of documentation is required, how quickly they have to get back to you, that kind of thing. So it's a bipartisan bill that's been introduced in both the House and the Senate, with, like I said, bipartisan co-sponsors. And so we are hopeful about this year in continuing to gain co-sponsors. A co-sponsor is someone who says, yes, I agree, and I want to sign my name to this legislation. So you start with an original set of folks who say, this is my bill, and you add additional people who sign on and say, yes, I agree, I support. And that's a lot of old-fashioned lobbying, going and meeting with offices, explaining the issue, and explaining why they should support the bill. In terms of, what you can do about it, when it looks like there's going to be action, we'll probably send out an action alert on the Safe Step Act, either encourage your members to co-sponsor or encourage your members to vote in favor. Again, depending on what action it looks like Congress is going to take on it.
Okay, great. The Home and Community-Based Services, HCBS, I hope I got that right. Access.
Yes, you did.
Can you talk a little bit about that?
Absolutely. So home and community-based services are day-to-day, in-home or community-based services that people with disabilities need to live their day-to-day lives. It can be something physical, like personal care, getting dressed, taking a shower. It can be support during the day, to do things in the community or to work. It can be a lot of different types of services. It's used mostly by people with, some more significant disabilities, physical or intellectual disability. And right now, the way it works, a lot of folks, if you have these services, you might be familiar with the waiver program. You've got to enroll in a waiver, and waivers have waiting lists. Unlike other Medicaid services, these states are allowed to cap them and say you're not allowed to enroll yet. They also create silos where you have to enroll in, say, the physical disability waiver or the TBI waiver or something like that. The HBCS Access Act is a bill at the federal level, led by, among other people, Debbie Dingell from Michigan, to say, okay, we're going to no longer have waiting lists, and we're no longer going to have these silos of services. We're going to say HCBS is treated like any other Medicaid mandatory service. A core set of services you can receive. You don't have to be on a waiting list, and this is important to a lot of families, you could then move from state to state and have the same set of services available in other states. This is a major problem people encounter where they wait on the waiting list forever, they get services, maybe they have services for a couple of years, and then they need to move for whatever reason, and they find they have to switch states and go back to the bottom of the waiting list in that new state. So this would address that. We were very involved in the drafting of this legislation. It's been put out in what's called a discussion draft, which is like a wonky term. Basically, it hasn't been formally introduced, but the legislative language is out there because the officers wanted a lot of input from the community on how this would work. These services are so important to so many people, wanted to get a lot of input before it was formally introduced. So it was out for a comment period. That comment period has ended. And now the officers are looking at the comments they received and should put out a bill again, formally introduce the bill very soon, which is pretty exciting. It's exciting to have members who are really interested in solving this problem and want to make sure that people can get access to the HCBS they need.
Excellent. So the CDC grant, I know I don't know if it's been submitted or it's in the process of being submitted, but I know the Epilepsy Foundation is submitting requests for additional CDC funding. So can you talk about the status of that and what that means and kind of what's next?
Go for it, Laura.
Yeah, this is where I can hop in on CDC funding. So the Centers for Disease Control has a program specifically for epilepsy. So it's obviously public health related, a lot of public health research, data surveillance. There's also a lot of aspects to the program about connecting people with epilepsy to specialty care as early as possible. Like, for instance, there's a Project ECHO under the program that helps connect epilepsy specialists to other types of healthcare providers, primarily in remote, rural, otherwise underserved areas. So again, this program at the CDC, which is epilepsy specific, the funding starts from the federal government and then flows down to help locally people with epilepsy. But the funding has to go through the annual congressional budget process. So every year, anyone who's interested in this program continuing, including the Epilepsy Foundation, we have to work with Congress to make sure that the funding continues. So from an advocacy standpoint, we as the advocacy team, kind of lead this effort. We do a lot of meetings with members of Congress who sit on the appropriations committees, who are essentially the first ones who recommend certain levels of funding. And then the spending bill, works its way through Congress as any typical bill would. Congress technically is supposed to finish their budget work for the federal fiscal year, which starts October 1 by September 30th. Unfortunately, that never seems to happen anymore. So our budget appropriations, lobbying and advocacy really is all year round because we never quite know when Congress is going to wrap up the budget for the year. Often they miss that October 1 deadline, and then they pass what are called continuing resolutions to essentially buy time for them to get the budget bill done. That could happen in November. Sometimes it hasn't happened until like March. So in terms of where the budget part of it is, Congress is really just starting the budget process for the federal fiscal year 22, which again is set to start October 1. Like the appropriations committees are starting to have hearings and markups. The House of Representatives is expected to mark up their bill that would include the CDC epilepsy funding, hopefully this month. The Senate isn't expected to act act on that bill probably until after August recess. So in terms of the budget part of it, that's where it's at. And then Russ referred to, in terms of helping the CDC implement this program, they have what are called cooperative agreements with entities to help, plan what the program is going to look like, figure out the needs in the community, and then the big part is like helping deliver the program across the country. So the Epilepsy Foundation has been the fortunate recipient of that cooperative agreement with the CDC on the epilepsy program for several years now. Every few years, the cooperative agreement, they very fairly have to, put it out there again, rebid, see if there are any other interested partners. So that's where we're currently at. The Epilepsy Foundation has resubmitted, an application to continue to be the partner. And we will find out, in the next few weeks, I think, actually, if EF continues to be the cooperative agreement partner, or at least one of them. But regardless, the funding, helps our community. So we will continue to advocate for the funding and help shape the program as much as we can.
Great. Now there's a couple of plans put out by the Biden administration that contain elements that certainly seem like they would be beneficial for the epilepsy community, and the American Families Plan and the American Jobs Plan. And I'm not sure the degree to which Epilepsy Foundation is involved with these, but if you could speak to, what any components of these that you may or may not get involved with, or that people might benefit from knowing about.
Sure. Yes. And the administration put out the jobs plan and then the families plan. Although I'm going to talk about them both together because at least right now, Congress isn't necessarily thinking about them, as like one bill they're going to do. It seems like there's going to be some kind of infrastructure package which is loosely based on the jobs plan, and then another piece of legislation that's going to be maybe, at least if I had my way, more healthcare focused. So I'm going to kind of talk about them together in what we have been describing as the next legislative package, because the process is kind of unclear even to us, which is a long way of saying if you are confused, don't worry about it. We will continue to do a push report for you on what Congress is considering. So a couple of the things that we have been really involved in pushing is, one, in the American Jobs Plan, there was a call for $400 billion investment in what they call care infrastructure or the care economy, what we call home and community-based services. And that's truly astronomical amount of money. It really shows the seriousness with which the administration takes this issue, which is very, very exciting to us. And what they want to do with that, which we think is a good idea, is both improve services, but also improve wages and working conditions for the direct care workforce. And we think those two things really go hand in hand. They need to be done together in order to best improve home and community-based services. We have been in communication with Congress on some ideas about how exactly to do that, although the outlines of that are still being worked out. But we're very supportive of that investment. This would be in addition to the additional funding for HCBS that passed in December. So this would be on top of that. We said it's kind of a down payment, and this is the next step in improving home and community-based services. The administration has also called for paid family and medical leave. We are definitely involved in that, especially through coalitions with other patient and disability groups, saying things like this. We really support it, and that we need to make sure not to lose the medical leave part of paid family and medical leave. Of course, there's a lot of attention on family leave, on parents of young children, and that attention is absolutely well deserved. We want to make sure that this leave also includes people with intermittent conditions like epilepsy, need for maybe paid leave to take some time off of work to deal with a personal medical issue or to care for a child with a medical issue, or just, have time to make it to a medical appointment and not have to forego wages. We think that could really improve the lives of people with epilepsy and improve their access to care and treatment, because then they're not being asked to choose between, their job and treating their condition. And then finally, we really want to make sure that the next plan and package includes enhancements to access to healthcare. I've talked about access to healthcare a whole bunch of times, but so we want to make sure that people can afford the premiums, people can enroll in coverage. We also want Congress to take action to address high deductibles and high cost sharing. So, affordability of health coverage, it's not just about premiums anymore. It's also about the ability to use that insurance to fill your prescriptions, to go to the doctor, to get the care you need. And when you have very high deductibles, that's still unaffordable to you, even if you have coverage. So those are some key areas that we have been focusing on. Of course, those packages are huge. There's many, many other issues at hand, but that are some things where we are focusing our asks to Congress that they implement from the President's plan.
Excellent. And certainly people can read up on what else is included in those plans, because there are some other things that may be of interest to you. So, and can, again, contact their legislators to let them know that certain elements of these plans are important to them. So, okay. Are there any other issues that you are currently working on that you wanted to bring up, including any Michigan-specific issues that you might be familiar with or involved?
I did have one more Michigan-specific issue, and that is there's a bill in Michigan regarding non-medical switching, which has to do with when an insurance company decides for you that they are going to change your medication. Either it usually has to do with a formulary change, but not always. In the middle of a contract year, they say, oh, well, that drug's going off formulary. You have to take this other drug. We think there should be protections, especially for people with epilepsy and other conditions where switching the drug is not that easy. It is a very big deal. That bill, I looked at it before this call. It, at least according to the website, seems to be maybe stuck in committee, but I worked a lot with Brianna, your executive director, on some of the language in that bill, and I know she was working with the co-sponsor on making sure it had all of the protections that we think are needed to protect people with epilepsy. So hopefully that language is right, and we can move that bill forward either this session or next session.
Okay, excellent. So we mentioned research funding and research as one of your buckets. So research funding, particularly through the National Institutes of Health, or NIH, is really important, and there have been multiple analyses of NIH funding for specific diseases and kind of the extent to which this is appropriate given disease burden. And kind of the concept of disease burden takes into account the disease's prevalence and severity. So I took a quick look at some of these and saw that epilepsy was generally appropriately funded or maybe slightly underfunded. But Laura, how has Epilepsy Foundation worked to maintain or increase this funding level? And what, if anything, can we learn from other diseases that are overfunded? We see some conditions that get significantly more funding than their prevalence and severity might warrant.
Sure. Research and innovation is one of our kind of broad issue buckets. So a lot of things in there, but two of the primary federal government medical research entities are one, what Russ mentioned, the National Institutes of Health, and another one is the Congressionally Directed Medical Research Programs, which actually sits under the Department of Defense, and is complementary to the type of research done at the NIH. That done by CDMRP is more like high risk, high reward, so it can kind of help research get out of the gate that otherwise might not. You know, it might be like a little too aggressive for the NIH, what have you. So we do work on both of those broad funding streams for research. There's kind of a general rule of thumb not just in epilepsy and like the broader medical research community, that most of us do not advocate specifically for disease or even institute-specific funding. And the reason there, it might sound a little strange, but essentially it's kind of seen as a faux pas to interfere with NIH's rigorous medical research, reviewing applications process, and really giving NIH and the experts, the medical research experts, the autonomy to decide which research projects should be funded based on scientific merit. So instead, rather than going up to Congress and saying we want X dollars to fund epilepsy, which again generally does not go well because Congress too does not like telling the NIH what to do. So instead, we advocate for a bigger pot of money overall for the NIH, so that in turn, more money can be spent in specific disease areas, including epilepsy. So, and if you look at the trends over the years, fortunately, NIH funding is an issue that is very bipartisan, has a lot of congressional support. So we have seen, $2 billion, B with a boy, increases for the NIH overall, each of the past several fiscal years. So again, going from like fiscal year 20 to 21, again, like a $2 billion or more increase for the NIH overall. And the NIH does track, by disease state, how much money each year is spent on each disease state. So we do see that by increasing the pot overall, epilepsy research has seen increases over the last few years, like in preparing for this call, in 2014, for instance, epilepsy research, NIH funded about $154 million in epilepsy research. And then in 2019, when the overall pot of NIH money was more, epilepsy, NIH funded about $188 million in epilepsy research. So fortunately, we do see again that the overall pot of money being increased is having a positive impact on the amount of money spent on epilepsy research. But all that said, we do still understand that, it's up to organizations like ours that are epilepsy specific to relay to government entities like the NIH both the progress we've experienced due to investment and the remaining gaps and needed areas of focus. So we advocate for the pot overall, but then there are some more specific ways that we advocate with the NIH directly, like occasionally the NIH will put out requests for information, like NINDS, which is one of the NIH institutes of neurological disease. So obviously one of the big ones that relates to epilepsy. NINDS has been working on updating their strategic plan. So the Epilepsy Foundation and actually us, along with a bunch of other epilepsy-related orgs, submitted comments to NINDS as they're working on their strategic plan in terms of, what we hear from our community and researchers and what we think needed focus areas are. And NINDS also has an effort they've had going for several years called Curing the Epilepsies. And same deal, we submitted comments as that NIH Institute is looking at how to better tackle epilepsy and make even more progress. And then there are also distinct mechanisms that we use, like through the congressional budget process. It gets very wonky, but essentially, when the House and Senate Appropriations Committees work on their spending bills that fund the NIH, we have been pushing for specific language related to epilepsy and again, like what we think the NIH should focus on. So again, it's like not mandating that they do a certain thing, but recommending that they look into this, these parts of epilepsy research a little more. So just kind of guiding them as they, go through, again, the rigorous scientific process.
Great. So there are several laws designed to protect the rights of people with disabilities like epilepsy and prevent discrimination. We referenced some of them earlier, the ADA, Individuals with Disabilities Education Act. Despite these laws, however, discrimination can still occur, and people with epilepsy may not always be able to access all the services and supports to which they're entitled. So Laura, can you talk about the Foundation's legal advocacy program, the types of support it can provide, and some of the more common issues that this program helps to resolve?
Yes. So the Foundation, we have our Jean A. Carpenter Legal Defense Fund, and that is named after an attorney who lived with epilepsy. She was actually the first person with epilepsy to chair the Foundation's National Board of Directors. So she had a long history, both just being a person with epilepsy and an attorney who worked to both create and enforce the rights of people with epilepsy and with our organization. So this fund was created in Jean's honor, and it exists to fight epilepsy-related discrimination in all aspects of life. So essentially what that means is we have a great staff person on board who manages this fund and advises people with epilepsy or anyone else who might have a question. Like, we often get questions from attorneys, who are representing people with epilepsy in various aspects, and connecting those, again, whether they be people with epilepsy themselves or attorneys or family members, to resources that will help them with whatever they're experiencing. And the fund has always been managed by a great, legal expert. Currently, we have Allison Nickel. She's been with the Foundation for over 2 years. And Allison, we're incredibly fortunate to have her. She's one of the premier disability rights attorneys in the country. She actually ran the U.S. Department of Justice's Disability Rights Section for many years. So again, just super fortunate to have, versus an attorney who might have to do a little research every time someone calls. Allison literally just knows everything because she's lived it and practiced it her whole career. So, and just kind of a sampling of situations that come into Allison, the organization, and they get funneled to Allison. She'll hear from students or families who have a student who are being told they can't participate in a sports team because of their epilepsy. Say they're on the swimming team and their coach finds out and they're like, it's too dangerous, we don't want that happening. Allison can help advise the family on their rights and what to say, that can't happen essentially, and help the family navigate that process as they do their own advocacy locally. We get a lot of employment situations, not surprisingly, just around, I have epilepsy. Should I proactively disclose that? Do I have to? What's the process if I need a reasonable accommodation at work? How do I do that? Education is another area. If a family has, a student or child with epilepsy with, who has higher needs when it comes to learning, all the individualized education plans, how to navigate those processes and make sure that the kid and their family gets what they need, up to situations, very scary situations. We've had families who have a loved one who's incarcerated and they have epilepsy and they're not being given their medications, and just again helping them learn what to say and how to make sure that their loved one gets what they need. So that's just a sampling, but it's a really critical part of the foundation, I think, again, just making sure that rights are known and enforced.
Absolutely, and a great resource for us to be able to access. So So as you know, driving restrictions can have a huge impact on the ability of people with epilepsy to find and maintain employment. And of course, this can contribute to social isolation and limit independence and restrict access to health care as well. What are some ideas the Epilepsy Foundation has explored to increase access to transportation, particularly when it comes to employment?
Sure. So yeah, we work on transportation quite a bit. We often do transportation policy in partnership with other disability organizations because we have a lot of mutual goals, and basically we often just add the epilepsy lens in terms of our specific community's needs. But for instance, the Epilepsy Foundation, along with the provider organizations, the American Academy of Neurology and the American Epilepsy Society, way back in the mid-90s, they had put out a consensus statement around driver's licensing and epilepsy, you know, what they thought good parameters for, first and foremost, promoting independence, you know, making sure as many people with epilepsy can hold driver's licenses as possible, while balancing both personal and public safety. So there's a recent effort where we were looking at those. Obviously, the mid-90s was a long time ago, figuring out if anything needed to be updated. And then that consensus statement actually also has like model statute and model regulation for driver's licensing situations, which again are always, you know, regulated at the state level. We actually activated EPAC and, you know, got some good input on that. So that's more of like a consensus statement, which in turn leads to policy. And I'll turn it over to Rachel in a second to touch on some of the state level specifics we've seen in the driving realm recently. But I think you might have mentioned autonomous vehicles. You know, that's obviously with technology and the world changing, that could provide a great new avenue for people with epilepsy who haven't been able to hold driver's licenses, a way of getting around. So again, with the broader disability community, we had put out principles around autonomous vehicles as, you know, they come to market and as they start to get regulated. And, you know, again, lending the specific epilepsy lens, we wanted to make sure that those principles contained that there would be no need for the individual to hold a driver's license because certain levels of AVs, they could still safely operate. And when it comes to rideshare, you know, companies, Uber, Lyft, et cetera, are also a big thing these days. And they do so much for so many people with disabilities. But the disability community at large also honestly has some qualms with them too, because a lot around physical mobility and physical accessibility, you know, there's no requirement for rideshare companies to make their vehicles accessible. So that's kind of one we shoulder in terms of we want to, you know, make sure that they continue to be available for people who can use them now, because we know that it helps a lot of people with epilepsy, but also continuing to educate and work with the companies to make sure they understand that moving towards broader accessibility for all is really important. And I'll turn it to Rachel to touch on any state-specific driver license stuff.
Yeah, I've been working with a couple of states on their driver's licensing laws. I will say, unfortunately, in the last couple of years, we've seen more of a focus on restrictions of licensing than expansions, although I think I did have a conversation with your professional advisory board at ES Michigan about I think there's maybe some interest in, you know, in an expansion, although I think it's still at the very, very, very early stages.
Yep. Yeah, we just had a conversation with a state legislator and are moving towards, what some ways that we can potentially clarify and enhance and eliminate some unnecessary restrictions. So, yeah, we're excited to move forward with that. So.
Yeah. Unfortunately, in the other states, we've been seeing, pushes towards longer periods of seizure freedom, even some, mandatory physician reporting and other stuff that we're really concerned doesn't increase safety and instead just puts a greater burden on people with epilepsy.
Okay, great. Well, I know I had some other questions, but I do want to open it up for questions now, and if we have a gap or a lull in the questions, I may jump in with some of the questions I had prepared. So, but let me go ahead and open it up to questions, and then we will see if anyone has anything they'd like to ask. Just a moment here. Okay. Does anyone have any questions you'd like to ask Laura or Rachel? All right. Have a shy group. But if anyone does have questions at any time, certainly jump in. But one thing I wanted to ask is, are there any government programs or benefits that people with epilepsy may currently rely on and that are currently safe, but that we should be vigilant about because they could be future targets for cuts?
Sure. Yeah, this is Rachel. I can get started. I'll start with good news. So that there's something called the Children's Health Insurance Program. It's it's health insurance for children for families that make too much to qualify for Medicaid, but still might be able to not afford insurance. That is authorized for the next 10 years. So Congress does have to reauthorize it for it to continue to exist, but 10 years is a long time. So luckily that is stable and will be available going forward. We expect it, of course, to be reauthorized when that time comes up, but it's nice when we don't have to do that and they can just carry on. Programs like supplemental security income or Social Security disability insurance are probably stable. There are efforts to improve those programs. I have SSI has very low asset limits. SSDI has waiting periods. There's efforts to make changes to improve them. There's probably a small chance of that happening, but probably not very likely. But also, luckily, there's not current threats to undermine them or try and make them provide an even lower amount of support for people with disabilities. The Medicaid program that I mentioned is probably safe under this administration. The last administration really wanted to make cuts to the program, like the work requirements I discussed. This administration does not. And then Medicare in general is very popular, incredibly popular, with the caveat that again, there's those 6 protected classes. We just had a victory protecting them. But, the protected classes are an interesting issue in that, if you watch the news, you would assume everything is a partisan issue. It's Republican v. Democrat. That is not how the protected classes have been. They have bipartisan support in Congress, but bipartisan threats from the administration. So both the Obama and Trump administrations tried to undermine them, and in response, bipartisan folks in Congress said, no, you're not going to do that. So I think it's stable because we continue to enjoy bipartisan support in Congress, and Congress is who writes the laws. But I just wanted to flag that issue is a little bit different than others that you might have heard of. But I would say it's safe for now.
Okay, great. Can breathe easy for a bit at least. Any questions? Go ahead.
I'm sorry. This is Sonia. I have a question. First of all, I do want to congratulate the team on protecting the 6 protected classes. But I have a question in regards to Medicaid and protecting your IRAs. There's is it an irrevocable trust that can be established? Can the attorneys at the Epilepsy Foundation help with that situation?
Go for it, Laura.
Yeah, I think that's Sonia. Yes, Allison, we would probably refer that to Allison, and she could probably do some general advising, and then what would likely happen is she would help connect you to, whether it be an attorney or further advisor who can, because Allison, again, she is a disability rights attorney. She's very knowledgeable, but she's not like actively practicing for us at the Epilepsy Foundation. So she kind of serves as a first stop in terms of advising, educating, and then connecting to anyone else if you need like deeper, whether it be legal representation or what have you. But yes, we could certainly start that conversation. We'd be happy to help.
Okay, thank you. Yes, it is, Sonia. Thank you.
Excellent. Other questions?
Yes, this is Matt from Monroe. I got a question. Would you know if insurances dictate doctors on what kind of medications we can take? Because I got to take certain kind of medications, and I'm afraid that the insurances can just say, well, I'm not going to cover that kind. The doctor wants me to take certain manufacturer, and I'm kind of afraid that the insurances are going to say, well, I'm not going to cover that manufacturer. Do you know anything?
That's related to the non-medical switching that we mentioned earlier, but maybe you can also speak to the generic versus brand name issue and that coming up probably fairly often.
Sure. Yes, this is Rachel. So unfortunately, in general, your insurance company does have a lot of power over which medications they cover, which then tells, of course, which medications you can take unless you can afford to just not use your insurance and just pay for your prescriptions, which is very, very few people. So effectively, they do have that control. It, of course, depends on a whole number of factors. Your insurance may have an exemptions process, or maybe you can appeal. But again, of course, that depends on a number of factors. What they're trying to do is it step therapy? Is it a prior authorization? Are they trying to change your med? Is the med just not covered? Or like Russ brought up, is it a medication that has a generic, but you need to take the brand? Again, that I think I would encourage you to look into like an appeal process. And one of the reasons that we work on this legislation is not to say you can't use step therapy or you can't have a formulary, but to say there has to be a way for a person who really needs the medication to access it via an exceptions or appeals process. So I hope that was helpful, but in general, your insurance company does have power, but also you have the ability to fight back by trying to go for those exceptions or appeals.
Hi, this is
Sonia. Thank you.
I'm sorry. I didn't mean to interrupt.
No, go ahead.
I worked at the University of Michigan, and now I'm on Medicare and through HAP, so a Medicare Advantage plan. And I had to go through prior authorizations and also step therapy. And you have to prove in many cases that you've failed on other medications. And so I was able to get my medications approved. And so you can get there. It is a difficult process, but you can get there. It's just a matter of really working with your physicians and your nurses to make it happen. I actually found it easier, believe it or not, through Medicare than I did through the University of Michigan. So it's just a matter of making it happen. And
Yeah, yeah. And so the physician is certainly a great partner in that, in writing letters to explain why a certain medication is needed, but also there's also an organization or a department called DIFS, or Department of Insurance and Financial Services, through the state of Michigan that can help with um, filing a complaint, basically against an insurance company or insurance provider, and their decision. So if you've tried the internal process to appeal and that has not been successful, you can then consider going through that department. And but I am noticing the time, and it is 1:30, so I do want to wrap up the call. And again, thank you everyone for participating, and thank you, Laura and Rachel, so much for such an in-depth overview of public policy advocacy. And I encourage everyone to get involved in whatever way you can. Like we mentioned, that whole spectrum of engagement, and I think there's something there for everyone. And I will post in the recording of this that we put on our YouTube channel. I'll be sure to post a link to the Speak Up, Speak Out program so that people can sign up if they haven't already. So thanks again, Laura and Rachel. And any closing thoughts, Laura?
No, this is Laura. I mean, just thank you so much for the opportunity. Thank you to those of you who are already engaged in advocacy, and any of you who aren't. Yes, we welcome you with open arms. We are here to support you. And again, it's really your stories and experiences that drive the change that the broader community needs. So thank you for your interest, and have a great afternoon.
Great. And
Thank
keep
you.
up the great work. Thanks again.
Thank you. Take care.
Yep.